I am Dr. Mohan Kameswaran. I am an ENT surgeon and I am the head of the Madras ENT Research Foundation in Chennai, which is a Chennai-based hospital, which is an exclusive ear, nose and throat and head and neck surgery facility. Deafness is perhaps the most poignant of all handicaps because a person who is deaf does not elicit sympathy. When you are blind, when you are physically challenged, your handicap is visible to others, it's obvious to others. But when you are deaf, you just look like any other person and nobody knows that this person is profoundly deaf. So if somebody talks to him and doesn't respond, he is usually mistaken either for a fool or for a very arrogant person. There's no sympathy there. At the same time, it's also a double handicap. Somebody who is born profoundly deaf is also dumb. They have no language. So they can't communicate, they can't fight for their rights. So they have, in many ways, it's the worst handicap that you can have. But deafness is also the commonest congenital anomaly to affect children globally, all over the world. 1 out of every 1,000 live births, every 1,000 children born, is born profoundly deaf, and an additional 3 or 4 of them have partial degrees of deafness. Partial deafness is correctable with a hearing aid, but a profound deafness is not, and it needs often more intricate interventions which are more costly and expensive. Now in India, the burden of deafness is twice that of the world as per WHO statistics. So we have 2 out of every 1,000 children born profoundly deaf. But my own state of Tamil Nadu is the deaf state of the country because we have a whopping 6 times the world averages. 6 out of every 1,000 children born in Tamil Nadu are born profoundly deaf. And the reason is not very difficult to find. The reason really is the widespread practice of consanguineous marriages, that is marriage between cousins. Now this is something which is seen in many parts of the world. It was in fact even present in Europe in the Middle Ages. But here it continues, particularly in Tamil Nadu and parts of southern part of Andhra Pradesh state. And this results in genetic intermixing of recessive genes from both parents, and there is a very high prevalence of deafness and other congenital anomalies as a consequence. The problem has to be addressed in several levels. Now, the easiest part which is to diagnose a problem. And then the next question is, what do we do after we diagnose? So we have to intervene. So the first diagnosis today, thanks to development in technology, we can actually diagnose a child at birth. In fact, it is standard practice in most developed countries now. Before a child is discharged from a hospital after birth, the child has to go through a mandatory hearing screening test. And it either passes the test or doesn't pass the test. If it passes the test, it goes home. If it doesn't pass the test, it still goes home, but they're closely monitoring the child and doing tests at periodic intervals to know whether this child has actually got a hearing loss, and if so, how much, and so on. So intervention has to start well before the child reaches a few months of age. We don't have such a scheme in India, but nevertheless, we are all trying to diagnose them early. So we have the technology, we have equipment with which we can diagnose a child at birth. And obviously, when a child is about 2 or 3 months old, we can do that. But very often in our country, the parents start suspecting that the child has a hearing problem well beyond 1.5, 2 years of age, when the child is not developing a language. And even then, some are dismissive, saying that, oh, they'll develop language, sometimes you speak late and so on. But when a child's language development is delayed, then that's the first indication that something is seriously wrong. And this child then needs a very comprehensive evaluation to find out if the child has got a hearing loss, if so, how much is the hearing loss, Is the hearing loss due to a problem in the inner ear, middle ear? Where is the problem? And again, if you have 10 children who are born profoundly deaf, 2 of them are syndromic, which means one other system is affected. The child could be going blind and deaf, which is a terrible tragedy. The child may be having problems in the heart, problem may be having a problem in the kidney, a thyroid gland, multiple. So you may have other associated anomalies, and you have to look for that also. So the workup of a child who's profoundly deaf is to be very comprehensive in a very good facility, and you have to have a person who is knowledgeable looking at the child as a whole, and also trying to establish the cause of deafness as well as the extent and severity of the deafness. Fortunately, a lot of very good developments have happened in this field in the last 20 years. Thanks to developments in the field of bioengineering and biotechnology, this was the first field where we introduced a neural implant. What do I mean? An implant which can actually integrate with the central nervous system. And I refer to the cochlear implant, which in many ways is the progenitor for all neural implants today. The cochlear implant is an extremely intricate device which is surgically placed in the inner ear or the cochlea. Now it so happens we have 2 good things going in our favor. One, the inner ear or the cochlea of a child at birth is fully adult size. So we have an adult sized cochlea. The second good thing is that 95% of children who are born profoundly deaf have their problem in the cochlea. Only there are 5% the problem lies beyond that. Now for children who have a problem in the cochlea, if you are able to bypass the cochlea and give signals to the nerve and to the central nervous system beyond, we can restore hearing. And this is the basis of a cochlear implant, where we surgically place an implant into the inner ear or the cochlea, and we are able to stimulate this cochlea by picking up sounds from outside and then sequentially stimulating the cochlea in different places. We are able to give back a sense of hearing to this child. And by doing this, we can restore hearing, and with hearing comes speech and language. And a child, who's let's say 1.5 years old or 2 years old who receives a cochlear implant is auditorily newborn. The ear is born on that day that you do the surgery and switch it on. But from then, within a year, the child will develop language if we give the proper habilitation to this child. And today we have cochlear implantees entering into IIT, we have cochlear implantees entering into medical institutions, we have them going into various professional courses and to the best Ivy League schools in the world, so in the US. So we have a cochlear implantee today who will be able to compete on equal terms with any other hearing peer of his or hers, and it's life transforming. It changes the life of a child, changes a child from a potential handicapped citizen to a productive citizen. More importantly, it changes the fortunes of a family. So this is one intervention which doesn't just change one person but the entire family, and therein lies the charm of the whole procedure. So with these cochlear implants, today we have been able to give hearing and speech to hundreds and thousands of children. In Tamil Nadu alone, we have over 3,000 children, or even more than that, who have got back their hearing and who are all now in normal streams, in normal schools and institutions of excellence. We have been in the forefront of a fight against deafness for the last 20 years. And Madras ENT Research Foundation is recognized as a pioneer in this area. We introduced cochlear implants in this part of the world. And we have been talking to our policymakers in the state. And I think one of our greatest achievements has been to introduce cochlear implants free of cost to every child who needs it in the state. So this is one state where a child who is born profoundly deaf can have completely free evaluation, diagnosis and intervention with a cochlear implant and then the subsequent habilitation. So this is a very far-sighted scheme by the state, and of course it is a very cost-intensive scheme, but it's also one of the most cost-effective schemes of the state. So with this, we have been able to now start dreaming, and the dream that we have is to be able to create a deafness-free state over the next 4-5 years. Now towards that, the state has agreed to a proposal from us to start a universal hearing, neonatal hearing screening program. And this is a unique challenge in this country because a lot of children are born domiciliary at home. So we have to reach them out. So what we are now trying to do is not just have a screening program in maternity hospitals, but also combine it with the vaccination program, with the oral polio vaccination scheme, where the children have more than 95% coverage. So same time, we also pick them up and assess their hearing, and also at a different level when they go into admissions into primary school. So at different levels we screen, and that way we hope to maximize our coverage of the screening program. This is a pilot scheme and initially being tried out in 2 districts in Tamil Nadu, and hopefully over the next few years it will spread out over the length and breadth of the state. And once we have a working model and we know that this is a viable proposal, then this is reproducible in every corner of the country. And I think our solutions have to be unique. It cannot follow the solutions outside the country. Our challenges are unique. Our solutions have to be unique too. But we are experimenting, and I think I'm very happy to say that so far the results have been very encouraging. And we look forward to trying to implement this on a large scale.